Tell me I'm recording.
Okay, sounds good. So today, like I said, talk about your anesthetic history and all that. Talk about the anesthesia for today. You have had surgery in the past?
Yeah, last September was the last one.
Okay, any problems with anesthesia in the past?
No.
Okay.
I mean, I wasn't awake for it, so I don't know.
Right.
I don't know. You tell me.
Any family history of problems with anesthesia?
No.
Okay, sounds good. Allergies to medications for you?
Morphine, Nubane, and just tape.
Tape. You do okay with the paper tape?
Paper tape's good. Yeah.
Okay, sounds good.
For some reason, this kind of tape don't bother me.
Okay, sounds good. And then as far as your medical history is concerned, I know about your high blood pressure. Any other problems with your heart at all?
Yeah, well, we don't have that anymore.
Good.
Nuclear stress tests, all of that. Heart's fine, no AFib, and I got taken off of my heart medication.
Perfect.
So, just
great.
Anxiety.
Okay, all right.
Anxiety.
Okay.
And
Xanax for the anxiety.
I take Xanax for the anxiety.
Okay.
As needed. I took one at 11 o'clock last night.
That's reasonable.
Yeah.
Right.
And I was still 15 minutes late for surgery.
Hey, that is
We made it
perfect.
though, didn't we?
Okay.
No.
Any chest pain when you exert yourself? You walk a couple blocks?
Not chest pain, no. Just shortness of breath. I have COPD.
Yep. COPD, and you have some asthma, is that right?
Yeah.
Okay.
Well, emphysema. They said
Emphysema.
emphysema.
Okay. You take inhalers?
Not anymore.
Okay.
It made my heart rate rise.
Rise
and
up,
that was something we found out
Okay.
with Dr. It's Robert Cartwright with Dr. Choi's office. She's
Okay. Perfect. Any recent increase in your symptoms? Increased cough, increased shortness of breath, anything like that? Fever, chills? Okay, sounds good. Kidney or liver problems? Diabetes?
No, A1C is 5.4.
Awesome.
Yeah.
Thyroid disease at all? Good. Okay. Any other major medical problems you can think of? You do have some heartburn, is that right?
No, not anymore.
Not anymore? That's all gone?
Yeah, I hadn't had that in over a year.
Awesome. Do you take medication for that?
No, I just quit
My
eating.
goodness, what did you do? You found the magic.
I quit eating meat and dairy.
Okay.
Yeah.
All right. Sounds good.
Eat more plants.
You're reminding yourself. Awesome. Well, good. Any other medical issues you can think of? Seizures, strokes?
Well, for what you're going to have to do, I went to Dr. Herr I was gagging on pills at one time.
Yeah.
My right laryngeal tonsil is bigger than the left one, and it's not a full airway on the right side.
Okay.
So,
That's good to know.
He said operating on that was impossible because of the you just can't do it.
Yeah. Mm-hmm.
So,
okay.
More trouble swallowing over here because of the bigger tonsil over here.
Do you ever have shortness of breath when you're laying flat or anything? I know you do have sleep apnea, is that right?
Yeah.
And you use a CPAP mask?
Yeah, on 9.
Sounds good.
Pressure 9.
Okay, perfect. Wonderful. So today, for anesthesia, we're going to be doing a general anesthetic. So you're going to be going all the way to sleep for surgery, okay? What we do is we go back to the room, drift you off to sleep through your IV, put in a breathing tube that keeps your airway open through the surgery, and then keep you asleep through the whole thing. That breathing tube comes out before you wake up, and most people don't remember any of it, okay?
Well, yeah, that'd be good.
I mean, any of the breathing tube.
Except for the sore throat, right?
Sore, scratchy throat is possible. Other risks with that tube, chance of injury to the teeth, lips, or gums, that's extremely uncommon.
She has dentures.
Oh.
They're cemented in. You can't get them out. Don't even try.
They really don't come out at all?
No, they're locked in.
Okay. So, the risk is that there's injury or trauma to those. Now that's very uncommon.
Right.
And we can use some techniques to help prevent that. But, you know, we usually, if they come out, absolutely we want them out. So
Yeah, they're locked in.
Okay, all right. Let's see.
How long will she be under?
Surgery scheduled for, I believe, about an hour and a half. So the important thing is I keep you asleep as long as it takes.
Right.
Okay.
Mm-hmm.
The other thing I want to talk to you about is something called the nerve block, and that's something we do before surgery out here.
Mm-hmm.
So what that is, it's an injection of numbing medication around the nerves up here in your neck. Those nerves innervate your shoulder and arm. We inject the numbing medication. It usually lasts for anywhere from 12 up to 36 hours after surgery.
It lasted 4 last time.
Did
4
it? That's it?
4 hours.
Well, there are some things we can do to try to help that last a little bit longer, because this can be it can be a painful procedure. And so, you know, obviously we want to get it to last as long as we can.
Yeah,
So,
good night's sleep would be awesome.
Yeah,
If
and
you could wear that.
that's my goal, is to try to get you through the night without much pain at all. So your whole arm from that nerve block will be numb. So you'll be in a sling anyway. It won't really matter to you. But I tell people, when you start to feel the pins and needles up in your shoulder, like your arm's coming back from being asleep, that's when you should start taking your pain medication.
So don't try to get ahead of it.
So once you start feeling that kind of pins and needles feeling, that's typically enough foresight, advance to get on top of it. But
Okay, yeah, because all right, I see what you're saying.
yeah,
You have to
and that's
judge
pretty
yourself.
much it. Yeah, you really do.
Well-
you know, but
Because it's impossible to determine how long the
block's
block's going to last.
That's what
Yeah,
she
It's
said. They
hard
try
to
to
get
make-
ahead of it
yeah.
and take. I don't want to take more than I need. Just want to take
Yeah.
it when I need
Right.
it.
Yeah.
Yeah.
So usually that works for people when they start as soon as you start to feel that pins and needles feeling. So
Okay.
that's pretty much it. Risks with that nerve block: anytime we put a needle through skin, chance of bleeding, infection, injury to surrounding structures, injury to the nerves itself is extremely uncommon. Okay, it's a very safe procedure. We do them all day. Really helps with the pain. So,
Yeah. Well, thanks.
yeah.
Pill free. What you doing in 36 hours?
Yeah.
Wouldn't that be nice if they could just nerve block you until you're healed up?
That would be
That
nice.
would be nice.
Yeah.
Especially since I got a high dollar sling. Might as
Yeah.
well put it to use, right?
Yeah. Yeah.
I'm just nervous and being silly.
No, that's fine. I have some medication for that too. We'll give you a little sedation medication for the nerve block. So, okay.
Okay.
Just it's sort of like your Xanax, only through the IV.
Oh,
It's better.
okay.
Yeah.
Okay, I'm going to be laying. I'm going to stand. I'll be standing pretty much, won't
Well, you're gonna go to sleep laying flat, and then we'll position you kind of in a sitting position, sort of like this. So
Oh.
for the procedure.
I? Okay.
But you'll be asleep for all of that. We'll go to sleep with you laying flat.
Do not let my mouth fly open like. Doris,
Okay.
please don't.
Sounds good.
Dignity.
I'll keep an eye on
Keep me
that.
dignity in the room.
Absolutely. No problem.
She says that, and then I'm gonna have that
No,
tube
no,
sticking
no.
out. I want to have that tube sticking out, looking like an old honking grandma out there on a autopsy table.
No.
Go there. So,
All right. Any questions about the anesthesia today?
No, you've
Okay, perfect.
been
Can I
very
have
thorough.
Yeah. Oh, no. You can't have some.
Oh, yeah.
If you had a question, I would answer
That's
that.
Patty. She's a drug seeker, y'all. Look out.
All right. Are you okay if
tried.
I take a quick listen to you?
Oh, yeah, sure.
Okay. Big breath. Good. Again. Open your mouth real wide. Awesome. Let me see back there. Okay. Any problems moving your neck around? No. Looks pretty good. All right. Now I'm just going to feel under your chin here. Perfect. All right.
Well, what was that? You hardly touched me.
Oh, I'm just feeling this distance here from your
Fur tube.
chin to your thyromental space. So that just helps us determine how easy it is going to be to put in a breathing tube.
So double chin helps, right?
Sure. Yeah. All right. Any other questions before we get this party started?
Yeah.
Okay.
Hey, if you notice that laryngeal tonsil or whatever, if you notice something about that when you're doing,
Yeah.
can you just make a note and let me know afterwards
I
so I
will.
can go back and tell Dr. Her
Yeah.
what?
Yeah, when I'm taking a look. Sometimes we can see them, sometimes we can't. So, but I'll see if I see anything, I'll let you know.
Yeah.
So
Okay, so
perfect.
just sore throat. Well, since I can't gargle that far down,
Yeah.
what would you suggest?
So
as being-
popsicles, cold, cold
Just cold
beverages.
stuff.
Yeah, just the normal stuff.
All right. And what is
most
your name
people-
again?
Laura Coates.
Okay.
Yeah, Dr.
You want to
Coates.
give my son a thumbs up with me?
Is this for your son? All right,
Okay.
perfect.
Bye. Going in.
You gotta have fun.